All right, folks, good afternoon. And it is that time of the week. Hope you're having a safe and productive week. This is the Marketplace Reset and Jumpstart TV, broadcasting live on several platforms, on radio, live on various social media platform, live on Jumpstart Economy, live, and also rebroadcasting on Tempo Television. My name is Anthony Weeks, and as usual, I'm joined by my dynamic duo colleague on segment number one that focuses on health, wellness. And today we have a special guest, like we normally do, and stored for you. I want to say hello to my colleagues, both Linda and Carolyn. How you guys doing today?
Doing well.
Outstanding.
Fantastic, fantastic.
Getting warmer up here.
It is? How warm is it?
Oh, we're not at Virgin Island warm, but we're getting warm.
You know, you guys are very. I gotta admire your ambition. You're really aiming for that warm in the tropics kind of thing.
We really
and
are.
It will pay off. I tell you, it's gonna pay off. I look forward to when you guys are underground here in America's Caribbean, America's paradise, on the beautiful island of St. Croix in the U.S. Virgin Islands. So looking forward to that.
Thank you.
Well, we appreciate that. And you cannot bust us for having positivity. So as we see the temperatures start to rise, we do get excited. We understand that we are in a fourth season environment, and we love that. But we do get excited when it does warm up and we watch those numbers. So
You tell them, Carolyn.
That's it.
exactly right.
it's not safe. But
Carolyn loves to, she just like to keep me like whoosh. She like to keep me in check. What I mean? It's every
In
so
a very
often
nice and positive way. Isn't it just smooth and how that happens?
Well, after you Barbara Waltered me that one day, I just thought,
What?
well,
No, I did not. No, I didn't. No, I did not.
Absolutely. Absolutely.
You're not gonna let me live that down, are you?
That was the best ever. I thought he's going to make us cry. He's Barbara Waltering us. But that's the beauty of when you're on, live radio, live TV, being able to share thoughts that come up just very, very organically. And that's what happened. And you thought you were going to tell us off.
Absolutely. Absolutely. So there's a lot going on. There's a lot happening around the world, but particularly in this country. And I'm amazed of how politics is eroding the type of things that are taking place in this country.
Mm-hmm.
I just think there's just so much just over politicizing just everything. And at some point, I can't even watch news anymore. I can't even watch the what's taking place, because everything has the narrative of every story has something to do with the politics, and politics has always been there, but it's just the infusion of politics, partisan politics it's a major turnoff. I don't know if these guys understand that. They're so deep into their partisan politics, and it is really such a turnoff that you don't even want to tune in. You don't want to listen. You don't want to hear anything from these guys. You know what I mean?
And ladies, what we're saying is that we really want to hear something that's going to help us move the dial forward versus stirring up a secular set of issues that seemingly never get resolved. They just have a different opinion on the spokeswheel, but we continuously go 360 degrees. And it becomes almost a funnel effect, 360 degrees, and we start to spiral down into just a few. I think, when we talk about health across the country, it shouldn't be politicized. We have learned the ills of that. We have had Americans and sacrificed their lives because of it. And, having a platform like this program, the Marketplace Reset, and having the kind of guests that we have on to talk about not only just their personal experience, what's happening in the sector, what's happening in policy, what's happening in politics is critical. It's a conversation, and we want others to join that conversation and be robust so that ultimately we can get back to caring more about our, caring, each person can care about themselves and their neighbors, their families, than we do power. Because ultimately that is what is up for grabs, and that is what is being tussled around these various subjects, is how to get and gain and keep the power in it.
Yeah, this
That's just my
us
opinion.
this constant us against them, choosing sides, and if you're not on the same side, it's all out, just
War.
attack and war, and the recent piece of legislation passed, the Biden $1.9 trillion American Rescue Plan, is just exactly that. It's literally making sure that every sector, every segment of the country is not left out. They're included. And when I heard former Governor Rick Scott, now U.S. Senator Rick Scott from Florida, telling states to reject, do not accept any help from the American Rescue Plan. I mean, it's like, who are these people? Who are these guys? I mean, it's people need help, and because it's not a GOP initiative, and it's the other side, you're now going to lobby to tell states not to accept any help. I mean,
it's an ideology. It's an interesting ideology, and we ask ourselves, how is that possible? Because the analogs of our social media, and therefore our conversations, are of like mind. And therefore, we're not pushing into and getting a different opinion, an opposing opinion, to understand where is this coming from and how is it being driven into the mindset. It is the power of the media, the social media, and therefore the conversation, that analog all the way through those platforms, even our sister and brother circles, our organizations. We're all of like mind when we have our conversations with ourselves, but can we step over that line to hear what we think is rhetoric, but it's really an ideology, a philosophy, an opinion, and therefore it becomes fact. And that's why opinion then becomes wrapped around these facts that are articulated by people who can be empowered, that you're just wondering, that's not even common sense. So where does it come from, and why is it being spilled out? That's where it is.
Yeah, I know we're going to bring in your guests shortly here. But when politics become a destructive force, we know the country is divided. And when you continue to pour gasoline on a situation just because you can, because it's your ideology, like you said, your ideology, your political philosophy, your views on how you see things, you're willing to scorch earth. You're willing to burn the house down because you don't get your way. I mean, that is, we're seeing how destructive.
Was that the insurrection?
It's
right, Carolyn?
I'm staying close-lipped on this because in every way. And I would like to say too, Anthony, much like Linda said earlier, I really love the fact that we have an opportunity here, because even though things are so clouded and people can get caught up in conversations that seem destructive, what we're doing here, much like with the forum that you had last week, to educate so many people for 3 hours, you put the facts and then the finances before them. So you were really offering help and hope. And when we look at our Wellness Wednesday, what we're talking about, you can't cover every single conversation and you can't stop every argument. But when you can feed people things that they can live on, that's really important. And I think that that's a lot of what we get to do here.
And we should remind individuals, those 3 hours that you referenced, related to applying for PPP, Payroll Protection Program, that is still vibrant. And we got great news that when we thought it was going to expire on March 31st, so everybody was scrambling. Literally, you have until May
31st, is it
May
now?
31st. But we don't want you to wait. So.
No.
Because it's until funds run out, and there's not any.
Well, and I want to just say real quickly, that's good, but it's not good. we have a tendency as human beings, we're very habitual. That when we think we have all the time in the world, we kind of sort of ease our foot off the pedal and figured we'll get to it when we get to it. And the danger with that is we saw what happened during the first initial release of the funds. Those who were more savvy and that were better connected basically suck all the oxygen out of the room. They capitalized. They exhausted the funds. And the folks who believed they had all the time in the world were Johnny come lately, and there was nothing left for them.
But to your point, there were some people that I had spoken with after the program last week who thought, I don't know if I can get everything together by March 31st, and they were going to throw their hands up in despair. So when they recognized that it is worth trying, still run to March 31st as that deadline, but it is worth it. So don't feel like you're going to have to go, because there are some things that you may have to go to an accountant for, your accountant that maybe you only dust off once a year. So go ahead and take that time. And if that accountant tells you he's so busy doing the taxes because April 15th is April 15th, don't give up. You still have time, but get the process going. So I think that gave them a lifeline and a little bit more. They felt like we're already pedaling as fast as we can just to stay viable, and now you're giving us all this homework. So I think that having that extra time period, let them know. Maybe you won't get it by March 31st, but try to have everything done by April 5th, April 10th, April 16th. Don't give up. This program is here for you.
And you're going to need it anyway, because you're going to need to get your corporate or your personal taxes in if you're interested in applying based on 2020. So for sure, you want to hurry up and get in, and you want to be in order to get some support. So I'd love
to know, Anthony, and when I know this is not the finance section and certainly not the political section, but I did want to know if at some point you can share with us numbers of how many people this program, the marketplace program, has been able to steer to getting loans. We'd love to know how many people have applied through the outlet. You don't have to tell us now. I don't want to put you on the spot, but that would be interesting, maybe even next week, to find out how the numbers are coming in.
Yeah, no, it's I think between last week and today, when I last looked, which was yesterday, I think we have about a dozen. I think we have about a dozen in the pipeline. And again, I don't know if the urgency.
But that's a dozen businesses that actually connect into several hundreds and possibly even thousands of employees. And so it's payroll protection. It's trying to get those entities back up. So we want the audience to understand that it's a number, but that's not the only number it impacts.
Right.
And we're proud of that.
Exactly.
That's excellent.
Yeah.
Excellent.
Yeah, I'm just concerned in the level of complacency can be a hindrance and problematic. And when people feel they have all the time in the world, that tend not to go very well. And so, I want to caution. I would like to caution people. I'd like to caution these mom and pop, freelancer, self-employed proprietorships, all these, that don't have they don't have the kind of banking relationship these other companies have with great attorneys, accountants, And
I just want to mention, as we start to segue into our guest, is that in one of my follow-ups, just like Carolyn, what resonated was, I don't want to take out another loan and then have to pay it back. So I spent some time explaining about the portion, the 60%, that it would be eligible and possibly more for forgiveness. And that, in fact, there are businesses that have had their first rounds and now their second rounds forgiven. So we have to really go through a stronger education and help businesses that need the money, but don't make them and apply for exactly the portions in those categories that are forgivable, that they really need to keep their business afloat or reopen and bring back their workforce. It's critical. It's really critical.
Absolutely.
So we'll do a better job. Tony.
Yeah, no, it continues. It continues. The work continues. It's going to be. It's going to take some stick-to-itiveness, consistency. To be able to keep the ball moving. So who do we have today? Who do you have on today as
wow
special guest?
You know, we have had an opportunity to hear from clinicians, from businessmen and women, from those who are speaking regarding policy, finances, just a real plethora of guests that have talked around the subject of health and COVID and business within all of that and policy. So today, Carol and I thought we'd bring to the audience someone that has a remarkable personal story of their own health triumph and what that really means as we go forward in thinking about post-COVID or COVID zero, living with an acceptable risk of COVID, which is COVID zero that you've educated us. How do we take care of ourselves in a way that's going to be for the long haul, particularly those of us, and I'm saying that because I'm going to get my vaccination, but I'm going to do it very, very soon.
And I did it.
You did?
Yeah, I had my second shot yesterday, and I feel fine. Slightly sore on this arm, but yes.
Good job. Good. Everybody in the audience, listen, because
And you know, I was so anti-vaccine.
She truly was, and I know that.
Once we had Dr. Angela Marshall on, and she debunked the myths, if you will, I immediately started registering everywhere I could. And because of my own situation and my age, I was able to get in. We have, our county is very, very vibrant in the way.
I'm so proud of you.
Yes.
I'm proud of you. I just wasn't in that category, but now we can. And so we have Brigitte Ann Greer. She is going to come to the stage. She's going to talk about her personal story. Here she is, beautiful person, has such a lovely conversation and really an inspiration. Today, it's really about her personal story, her advocacy for this subject that's near and dear to her heart. But just a little bit of background, she's one of our most esteemed attorneys in our hometown community of Prince George's County. She works for the government, and she has been doing so since 1988. She's been a county attorney for over 30 years. She is an advocate on donor transplant, something that can become very taboo in the African American and communities of color. And we want to take that shield off, and we get everyone in a very strong view. And so I'm just going to share that also. I'm going to let her tell her story and what has happened. So I want to just, she's an ambassador with the Washington Region Transplant Community and the Donor Life Maryland Living Legacy Foundation. So the subject today is about becoming a organ donor and the impact it can have on those who are living with or who have been a recipient of an organ transplant. So welcome, Brigitte. We're going to give you a new name. We're just going to soften it up and say Brigitte, but no, it's Brigitte. We love it.
That's so French.
It's so French for Prince George's County. So welcome.
Thank you. Thank you for having me.
You're very welcome.
For discussing this very important topic. And
it is an important topic. And, tell us a little bit of why it's an important topic.
It's a very important topic because there's so many people who are waiting for organ transplants, and there's so many people who die waiting for an organ transplant. And it doesn't have to be that way if we have people if we can debunk the myth of registering to become an organ donor, and you can just save so many lives, because an organ donor can save up to 8 lives, and a tissue donor can save over 50, over 50 and enhance the lives of over 50 people. So it's very important that people register to become an organ eye tissue donor, because when you do, you save lives and you change lives. And it was because someone registered to become an organ donor that I'm here with you today, because not only am I a double lung transplant recipient, but I'm also most recently a kidney transplant recipient.
Wow. We this is the Wakanda Forever. It's the new hug.
We learned that this is how you a healthy hug, virtual hug.
A healthy virtual hug. And we're glad that we can hug you, because you are here, and you're here because of the generosity of a family or families that saw the vision around sustaining life, and that life can be sustained through organ donation. I have, when asked the question on my license, I'm not going to show you the whole thing, but there's like a little dot that tells anyone, should the moment arrive and that situation occurs, that yes, I've signed up. I've signed up, and I've been signed up for as long as I've been driving, because that's where I knew that I could have that piece of information conveyed. Can you share with us a little bit of how someone would go about registering or letting someone in the community or in the healthcare field know that they want to become a donor?
Yes, you can register to become an organ donor by going to beadonor.org. You can also register on organdonor.gov. You can register with the Motor Vehicle Administration by indicating on your license. But most importantly, and this is just, I can't emphasize the importance of your family and friends, that your desire is to become an organ donor, so that they would know your wishes. And at that time, which is a very difficult time, they will know your decision, and that will be much easier for them to make in deciding to donate your organs, because you have already had that conversation with them. So you can register by going to beadonor.org or organdonor.gov, registering on your license with the Motor Vehicle Administration, but most importantly, tell your family and friends of your desire to become an organ donor at that time.
This is really super sensitive, but I'm the kind of mom that likes to have a conversation with my kids about a lot of things. Mm-hmm. And this weekend coming up, we're going to talk about opening up their stock brokerage account, and how to trade and all that kind of good stuff. And one of my daughters said, well, who do I give my money to if something happens to me? And I thought, well, me. And so she said, well, don't I have to tell somebody that? I said, well, you can give it to your sister, you can give it to your friends, you can give it to a church, you can give it to a nonprofit. So she said, well, I guess I have to have a will. And I thought, oh, you're right. Mm-hmm. That's not something that I thought about for minors, and then therefore having that conversation with them, because kids are smarter today than when I was growing up. Yes. Because there's a certain type of organ donor, children, that whole process as it relates to children, correct? Am I
correct? Because there are some organs, because of a child, like lungs, the size of the chest cavity is important, or the size of a heart. An adult lungs may not fit into the chest cavity of a small child. So yes, so it is important to have that conversation. But a person would have to be 18 years or older to register to become an organ donor. But if they express that to you and the family wishes to donate the organs at that time, that's also possible.
So it's another critical thing that we need to have as a family topic of conversation.
Right, because we talk to them about everything else, about money and about everything else. And this is just as important, because you're saving lives.
Yeah, I think that what you said there is really important, because there's been a recent study that says 90% of Americans agree with organ donation, but only 60% have actually signed up. So there is a real lag between everybody that says this is a great idea, and then those that have had those conversations or actually taken the steps to sign up.
Wow, Carolyn, that's an interesting statistic, because then that means we've got a real gap of information that we have to close down on. And I think with individuals like Ms. Greer, who is an advocate and talking about this subject and talking about it from a personal perspective, it does take away the fear. And what does that actually mean? Not only to be a recipient, but also an organ donor. Would you say that, Ms. Greer?
I would definitely say that. And to my understanding, I don't know who my donor was, but once after, there was a period of time after I had my lung transplant that there was a spot on my lungs, and the doctors thought it was tuberculosis. And the doctors couldn't understand how I had acquired tuberculosis when I didn't test positive, and my donor didn't test positive. And it was at that time that they told me that my donor was an 18-year-old white male that was killed in either a motorcycle or a car accident. And I don't know if he registered or if it was the family's decision. But I'm so glad that someone made the decision to donate his organs, and I was the recipient of his lung.
Wow.
And I'm happy to report that, well, the average life expectancy post double lung transplant is 5 years. And thanks be to God, most recently on March 14th, I celebrated 15 years as a transplant recipient. So there is life post-transplant, and you can live a full and rewarding life post-transplant. And if you don't mind, I'd like to tell you a little bit about my story.
We want to hear it all.
I want to hear it all.
I'm so glad that you do, because I want to tell you all about
it. Yes, because it serves as inspiration, and we want, the audience to send in their questions for you if they have those. So do tell us your story.
Okay, well, back in 1989, I was driving to work, and it was a bright sunny day, and my vision was becoming very blurry, and it was painful to see. So I went to the doctor, and I was diagnosed with sarcoidosis in my eyes. And sarcoidosis are inflammatory cells that travel throughout your body, and they attach onto different organs and create extensive scar tissue. And sometimes that tissue is irreversible. So I was treated with prednisone because there's no cure for sarcoidosis. And though it affects other people, it affects predominantly African Americans. So then the sarcoidosis lied dormant for about 10 years and before it attacked my lungs. And I was jogging and exercising, and I noticed that it became laborsome to breathe. And so I went to the doctor, and I had extensive scar tissue on my lungs that were irreversible. And I was breathing less than 40% capacity. And so when my doctor said that I would need a lung transplant, I'm like, I'm not going to need a lung transplant. And I just, dismissed the idea. But in 1999, I had to be hospitalized because I had pneumonia, which, affects the lungs. So while I was in the hospital, I was also diagnosed with an airborne disease called aspergillosis. And aspergillosis is mold and fungus growing in my lungs. So in addition to having the sarcoidosis, I also had mold and fungus growing in my lungs that I just acquired through the air. And so about 2 years later, I was placed on oxygen, and I had to use oxygen to assist my breathing. I mainly had to use it on exertion, but I was still continuing to work at this time, but it was becoming very difficult to breathe. I had a nagging cough. Sometimes I would cough so hard that I was bringing up blood because I was hard enough to burst blood vessels. And
wow.
Eventually, I went to a local hospital for a transplant, Johns Hopkins, but they said I was too high risk. And I don't think that they were prepared for someone like me, because though Hopkins is known for kidney transplant, double lung transplant is not their, what they, are known for. So they referred me to Duke University Medical Center in Durham, North Carolina. So I had to relocate to Durham for almost a year. And my mom came down to stay with me, and my husband would come down to visit, several times a month because he had to stay here and work. So with the aspergillosis, they knew it would create a problem, and they were giving me antibiotics to prevent it from seeping into my bloodstream and poisoning my bloodstream. But what they didn't know is that the aspergillosis had calcified and turned to bone. So a surgery that was supposed to last 4 to 6 hours ended up lasting 16 hours, and 2 sets of surgical teams to come in because it took much longer than they expected, because they had to break up the aspergillosis and take it out with tweezers prior to putting in the new lungs. And so I was out of work for a year. And when I went back to work, I went back full time, and my health continued to improve and increase. But the thing about being a transplant patient is that you have to take so much medication, and a lot of the medication is toxic. So the main anti-rejection medication took a toll on my kidneys. So in December 2018, I had a kidney transplant, which you can get from a live donor. So my niece donated a kidney transplant in December of 2018, and both of us are doing very well. So I have a whole lot of reasons to celebrate and encourage people to become organ donors, because without that person, I wouldn't be here today.
That's
I'm holding back the tears, because one of the things that I'm looking at you and I'm thinking the value of every breath you take, there is meaning to it. And tell us not only the fact that you're now back to exercising full time and having a full vibrant life.
Yes, the doctor told me at that time, had I not been in good shape, I would never have survived the 16-hour surgery. So prior to the lung transplant, I would take 2 to 3 oxygen tanks to the gym with me, and I would jog 5 miles on the treadmill. And before the transplant, rehab. So 4 hours a day. So I enjoyed that because it was just another form of exercise. To some people who are in the transplant program, that was their first time exercising. So in addition to exercising to maintain weight, and it's a stress reliever, to me, it's a lifesaver as well, because had I not been in good shape, I would have never survived the transplant. But I have a full exercise schedule. I exercise at least 5 to 6 days a week, a minimum of 2 hours, sometimes twice a day. I take a spin class at least 4 or 5 times a week. Sometimes I have a trainer when he shows up. I'll get on the treadmill for an hour. I'll get on a bike for an hour. I lift weights, though I have no muscles to show for all my hard work. But really, exercise, I can't overemphasize the importance of exercising for your health. And it has been a lifesaver for me.
Wow.
It's kind of interesting, because that's one of the things that I think we need to debunk. And that is that when you get a transplant, you have to almost have a very careful sedentary life. And that might be true in certain circumstances, but in consultation with your doctor, exercise, as we've heard from a lot of our guests, is a pivotal piece. Carolyn will be interested to know, and hopefully she's proud of me, that I started my big time exercise last week, and drinking my smoothies, because my COVID uptick is about to leave me. So I'm COVID-19, like freshman 15. You know what I mean, everybody?
Well, we know exactly. You gained 19 pounds. Is that what you're saying?
Yes, I am going to lose some weight.
Okay.
Did I say that on, out loud?
It's okay. But
Okay.
I see Anthony's here. Anthony, is it time for our break before we can continue this discussion?
Yes, absolutely. And when we come back on the other side, someone shared a comment on social media, and I think our guests should have the opportunity to hear what some folks are saying based on what they're hearing from our guests and her testimony and dealing with the condition that what she's been through. It's for me, it's a very I'm not even sure how to respond to it, because we just lost a young lady who was a Virgin Islander, and she was a recipient of a transplant. Either she received an organ, and it didn't work, or she was waiting and it never arrived. But tragically, she lost her life just recently. She died, and this was a young mother, young lady, and so she's been, for me, I think just the pain, just the tribulation, the agony. She's now at peace, not suffering, and it's a very difficult thing for me to talk about. So I just wanted to, when we come back from the break, and I'll share what the comment is on social media. But thank you so much, Bridget, for sharing your story with us. This is the Marketplace Reset and Jumpstart. We'll be right back.
The reopening measures are slowly taking place amid the coronavirus pandemic. Malls and restaurants are working again, and factories move more and more of their personnel back into the offices. However, that doesn't mean that people won't get sick anymore. On the contrary, there are now many more chances of spreading the virus even farther. To protect the employees and clients of your business, we developed thermocontrol screening stations. It is a quick and safe solution. Thermocontrol measures temperature at a distance of 25 centimeters. The device is autonomous. It does not require an additional employee to conduct temperature measurements or log the results. It can measure and even recognize masked faces. All of the results are logged automatically and stored in the database. You can use the station to ensure your clients and employees access to your building automatically.
John Smith, Brombach.
The station can issue entrance passes and grant access to the building after it measured the person's temperature. If the visitor's temperature is high, a notification will be sent and a potential carrier of the virus can't access the building. Thermocontrol can send SMS and messenger notifications, as well as notifications over email. Temperature measurement technologies allow businesses to ensure the safety of people and potentially save lives all over the world.
Back, and thank you so much for tuning in to the Marketplace Show Reset and Jumpstart here on the Callaloo Network, brought to you by SETI. And when our special guest is attorney Bridget Greer, and she is sharing her personal story, who's been through the process of receiving a donor organ and going through the transplant process. Like I said before the break, we had someone on social media who shared made a comment, and I just wanted to be able to share that with our viewers as well. And I don't know if it blocked your face a little bit, I apologize, but I just want to be able to, our viewers can see the same comment as well. Okay, can you see it?
Yes.
Okay. So that was from Brenda Rogers Booker. Says, wow, so happy and many blessings to Bridget. When my 22-year-old daughter passed over in her sleep, I was called and asked to donate her eyes, and my husband and I agreed. We were told that her eyes were unable to help two recipients. The ironic thing or blessing is my daughter was epileptic and had difficulty with her peripheral vision because of her seizures. It is a blessing, and now we are registered donors.
And if I might address that, thank you so much, Ms. Brenda, on behalf of all transplant recipients. Thank you for donating your daughter's eyes, and I'm sure that whoever received them is just so fortunate and so blessed. And thank you for you and your husband for registering to be organ donors. And I say that on behalf of all transplant recipients because we just never know when an organ or tissue or eyes are available, and we just linger and we wait sometimes, and oftentimes people die just waiting. And so thank you, because that may not have been an easy decision to make, but you saved someone's vision. Thank you so much.
And I agree with that and want to thank them as well. And that brings up an interesting point, because some people feel that if an individual has a medical condition, that they are absolutely not able to donate organs or tissues. But this shows that that is truly not the case. That's one of the myths that people thought, well, I have diseases, I have medical problems, so I can't donate. So that really, what a wonderful blessing that family was to someone else.
Right. And people will, you're correct. People will say, I can't be a donor because I have cancer or this or the other thing. But they do so much testing on the donor prior to recovering and procuring the organ and transplanting it into another person. There's extensive testing done. So the person shouldn't say that I can't be a donor. Let the professionals decide whether you can become a donor. And like you said, there's so many myths surrounding organ donation, that they'll take my organs without my consent, or that they won't try to save me if they know that I'm an organ donor. They won't even know that you're an organ donor while you're still living, or that my family will have to pay for the transplant. No, your family won't have to pay for the transplant. The recipient's primary insurance or Medicare and Medicaid pays for the recovery, the procurement, the transplant, the whole process. So that there's so many myths surrounding organ transplantation and organ donation that I would just try to encourage people to educate themselves prior to jumping to conclusions.
And can we take some of those and knock them down? You just shared a few, and particularly in the communities of color, because there is a known huge disparity between those who are in communities of color signing up and those who are in community of colors as recipients. So I think that there's some conversation around policy stemming from Health and Human Services and these procurement donor organizations, how those organizations need to be more effective and more efficient, and bringing across the board removing that disparity by in their selection process. Can you speak to any of that by chance in your advocacy work, and tell us a little bit about that as you debunk many of these myths?
Right. Well, some of the myths that I said was about that they won't try to save your life. People think that they won't try to save your life, or the medical professionals won't put in as much effort, but their primary responsibility as health professionals is to save your life. And they're not thinking about transplantation. Some people will say, well, I may not really be dead, and they're taking my organs. Well, you are legally declared dead. And there's so many, different tests that are ran to determine that your heart has stopped, that your brain has ceased functioning, and to determine that you're declared legally dead. And the doctor that declares your death is not the same doctor that procures and recovers the organs. They have to be separate and they have to be independent, so that there's no conflict of interest. People say that it's against my religion to be an organ donor. Well, most major religions consider organ donation an act of love and charity. And people have a concern. I would encourage them to reach out to their religious and faith leaders for guidance on that issue. But we do have to register more African Americans, because there's so many African Americans waiting for transplants, particularly kidney transplants, because of diabetes and high blood pressure and the like. And you can get a kidney. You can obtain a kidney from a live donor. So you can be a live donor. You don't have to be a deceased donor to donate a kidney. Like I said, my niece donated a kidney to me in December of 2018, and both of us are doing very well. And she went through extensive testing, because prior to that, my sister was scheduled to be my kidney donor, but at the last minute, they detected a lot of small kidney stones, and so they wouldn't do the transplant. So that's how my niece, her daughter, became so there's an extensive amount of testing done for live kidney, live donors as well.
Wow. And that, as you're saying that is so encouraging to hear. And I was one of the people in the African American community when my husband was diagnosed with a serious heart issue as a result of toxins. I was one of those people, like, I don't want it. All I could remember was 1967 and Dr. Bernard Christian from South Africa and that whole thing. And I thought a transplant
was probably the kiss of death. I think, from what I know of what Carolyn's. Oh, you're back, Carolyn. You're back. You're back.
We all spun off.
Yes, we all spun off. Technology. But I know your story is very compelling. Yes.
I was one of those people who needed to be educated, and I consider myself a fairly intelligent individual, and I was resistant to a transplant at all costs until I realized how important and how successful they could be, and how they, as you mentioned, you can have a full and rewarding life after it. So I just think that what you're doing is amazing. April is, donor month, National
Yes.
Donor Month. And so having people know that in advance, maybe we can get a lot more people signed up between now and when April starts.
Yeah.
Yes.
And just to reiterate, some of the organs that you can donate are heart, lungs, kidneys, pancreas, liver. Some of the tissues that you can donate are skin, cornea, veins, ligaments, heart valves. So a bone, so there's just so many organs and tissues that you can donate to save and enhance an individual's life.
It is remarkable the power of innovative medicine that allows for us to do that, and how we're able to do that effectively to sustain and create life, a strong, vibrant life such as yourself. So I have a question. Can you talk a little bit about your advocacy work, the organizations that really spearhead this message, this narrative, and what they may be doing, how we can support those organizations?
Well, my husband and I both volunteer with Living Legacy, Donate Life Maryland, and the Washington Regional Transplant Community. Of course, with the onset of COVID, that has impacted us advocating in person. So virtually, they have ongoing fairs, and there's a number of organizations and schools and colleges that will request speakers. But prior to the pandemic, we would attend health fairs to educate people. We would schools, churches, and just stress the importance of registering to become an organ donor. And so many people would come up afterwards and say, "Oh, I registered on my license," but I'm like, "But have you told your family members?" Because that's the key. Telling family members and friends, because they may not, notice that it was on your driver's license, and if you've never had this conversation before. So that's the key to, once you register, also telling people about it. So these groups go out into the community and educate people about the importance of organ donation. And
so Bridget, you're an advocate now, but I'm just curious, were you always pro organ donation?
No, I had never thought about organ donation. And I remember my mom, bless her soul, she came to live with me in North Carolina while we prepared for this transplant. And she said, I never thought about becoming an organ donor. And I don't think she ever registered, but the thought, didn't occur until it was happening to me. That's when it becomes personal. When it happens to a friend, when a friend or a family member is in need of a transplant, it becomes very personal. Then it's just not, it's not an option at that point. And so a lot of my friends, and I hope that my family members, but because of this, I will have this conversation with them again. And perhaps they are organ donors, but I will specifically speak to them because it's about that time to have that conversation again.
And I'm glad you said that. It's so encouraging to hear that you had to actually have a mind shift. I will tell you that the woman that actually, whose heart was donated to my husband, she had not told her family. She was an organ donor. They did not realize it until they were in that traumatic situation. So when you're stressing to tell the family, that could have been a layer of grief that they didn't have to go through.
Exactly.
It took them a while to wrap their brain around the fact that not only is this a tragedy and happened so suddenly, but now you mean to tell us we're not even going to get our whole daughter back. So I'm so glad you're saying that. So in your advocacy work, as Linda mentioned, if there are websites we want to go to, do you have any information how we could better educate ourselves as we're trying to get people, we're trying to figure out how to have those challenging conversations?
Yes, a lot of information on both those websites, the Washington Regional Transplant Community and Living Legacy, Donate Life Maryland. And they have very valuable information posted on their website. But I wanted to go back to something you said, because I had a friend who died of, I believe it was a brain aneurysm. And when the transplant people were talking to her mother about donating her organs, the mother was adamant against organ donation. But it just so happened that prior to that, I was on my way to the hospital to visit her anyway, before I knew all this was going on. And as you may know, once you become a donor, you're still connected to a ventilator to preserve your organs.
Right.
So she's still connected to the ventilator. But when I got to the hospital and talked to the mom, and I had no idea that this conversation would come up, I explained to her that I was a recipient of, a double lung transplant. And we talked about it. And as a result of her seeing me in person and seeing how healthy and vibrant and how my life was so full, she decided to donate her daughter's organs. And, sometimes it's just seeing a person or knowing a person, and most people will look at what I was pre-transplant. I was bent over, I had oxygen tanks, I was coughing, I couldn't breathe, and then they see me now and I'm always at the gym, or, and it's like two different people. And it's just amazing, to see the transformation and what, can be done through medicine and being a donor in transplantation.
And I would hope that it would also, for the family who is have agreed to make that donation or facilitate the wishes of their loved one, that would give them a place of peace to know that that was the ultimate opportunity to sustain life, that there's some portion, if you have to feel, that carries on, that legacy of love, and frankly, and of support for another life goes into that gift and that decision. So I'm glad that I had that experience. I won't tell Carolyn's story, but I think if I recall, I've seen pictures where some folks do get a chance to meet their donor, right? And are able to build an amazing relationship with them, I would imagine. I've seen beautiful stories and testimonies of those kinds of things.
Yeah, it is. And you mentioned, Bridget, that initially you never got to know the individual.
No, I didn't. And
or their family.
My center, my transplant center, encouraged the patients to wait a year before reaching out to the donor's family. And after a year, I reached out to the donor's family, not directly, because you have to go through your transplant coordinator, through this person, through that person. You don't have a direct connection. So I sent a letter. I hoped that it reached them, but I never received a response. But and I just wanted them to know how grateful I was about receiving the lungs. And it had to be a tough decision because, it's not, it's a very difficult decision. And it's troubling at times because even though I just celebrated my 15-year double lung transplant, my joy, my happiness is diminished by the fact that there's a family out there grieving the loss of an 18-year-old son, an 18-year-old brother, uncle, friend. And so though me and my family rejoice, my family and I rejoice that, somebody is grieving. And that kind of puts things in perspective because you almost have a survivor's guilt.
Yes.
And
yes.
That's just, it's more than just the physical challenges that you go through as a transplant patient, but it's also the mental challenges that you survived and other people didn't. Sometimes, whether your donor didn't survive, and sometimes other transplant patients that there were patients that had the transplant at the same time I did, and they didn't make it through the first year or the first 5 years. And here I am 15 years later. And I didn't do anything any different than they did. I was no better than they were. They took their medication, they, exercised precautions and did what they thought was right. But yet, I'm still here and they aren't. So, it takes you through a whole nother guilt process. So there's more to transplantation than just the physical aspect of it, this whole mental aspect.
You're here because you have a voice and you have a purpose, and that has connected into, I'm sure, many of our listeners and viewers to go out to the websites nationally. They can go on organdonor.gov, organdonor.gov, or donatelife.net, donatelife.net, and nationally register and be a part of helping the over 100,000 people currently looking for or hoping for an organ transplant of various types of organs. And so
we consider,
if I could,
please.
There's one of my favorite poems that I would like to read, and perhaps this will help someone who is undecided about registering to become a donor. I think that this will put everything in perspective for them. And the name of this poem is "To Remember Me, I Will Live Forever" by Robert Tess. And the poem goes, "The day will come when my body will lie upon a white sheet, neatly tucked under four corners of a mattress located in a hospital, busily occupied by the living and the dying. At a certain moment, a doctor will determine that my brain has ceased to function, and for all intent and purposes, my life has stopped. When that happens, do not attempt to instill artificial life into my body by the use of a machine, and don't call this my deathbed. Let it be called the bed of life, and let my body be taken from it to help others lead fuller lives. Give my sight to the man who has never seen a sunrise, a baby's face, or the love in the eyes of a woman. Give my heart to a person whose own heart has caused nothing but endless days of pain. Give my blood to the teenager who was pulled from the wreckage of his car so that he might live to see his grandchildren grow. Give my kidneys to the one who depends on machine to exist from week to week. Take my bones, every muscle, every fiber, and every nerve in my body, and find a way to make a crippled child walk. Explore every corner of my brain. Take my cells if necessary, and let them grow so that someday a speechless boy will shout at the crack of a bat, and a deaf girl will hear the sound of rain against her window. Burn what is left of me, and scatter the ashes to the wind to help the flowers grow. If you must bury anything, let it be my faults, my weaknesses, and all prejudices against my fellow man. Give my soul to the devil, and give my sins to the devil, and give my soul to God. If by chance you wish to remember me, do it with a kind deed or a word to someone who needs you. If you do that, and all that I have asked, you will live forever. So I encourage you to become an organ donor. You save lives, you change lives.
Bravo, bravo, bravo. I have to commend you for your bravery, and the fact that you're sharing your story is incredible. I can't imagine the number of lives you've impacted as people are going through their struggles. COVID-19 I can't imagine how it has further complicated the process. Organ donation is a very, very sensitive, delicate, complicated thing to begin with. And now couple that with in a pandemic, I just can't even begin to fathom what that's like. And so I want to thank you for your bravery.
Thank you.
Counselor, for taking the time and sharing with us, with our audience today. And looking forward to hearing all about more of the work that you're doing. You're doing incredible work. And looking forward to having you back on the program.
Okay.
Absolutely.
And be able to get some more of insight as to what's happening in your area of expertise and work that you're doing. So thank you so much.
Thank you for giving me a platform. Thank you for having me.
So much.
Well,
Thank
unfortunately, we've come to the end of the program, and we'll transition to our next segment, segment number 2. And ladies, Carol and Linda, as usual, great job. And until next week, thank you so much. Thank you so much, Bridget, for being part of the program.
Thank you, Bridget. Thank you, Linda. Thank you, Anthony. We'll see you all next week.
Okay, thank you.
Bye.
Good, bye.